Today, I want to speak with you about coronavirus and a few practical ways your family can stay healthy. First, hand washing is essential. Children should wash their hands after coming in from outside, before eating, after coughing, sneezing, or blowing their little noses. Second, limit all crowds and explain that no one is shaking hands or hugging because that is how germs can spread. While changes need to be made now, I encourage parents to let children know this will not last forever. I urge you to stay connected to family and loved ones, stay safe, and remember, while many of us are apart, we are all in this together. Please be sure to follow CDC guidelines, which can be found at coronavirus.gov, along with other information and resources.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable.
And I think it's going to look bright. So if we start off looking at our economic development and Kentucky innovation update, we had a couple of announcements this week that are really significant. The first is a structure. Here in Kentucky, we are committed not just to chasing the types of jobs that we have in the past, but truly building them up from within. It's time we help every entrepreneur out there, just like we talk about with agri-tech, to take the next great ideas, to make sure you get that intellectual property, to start your small business, and to ultimately scale it up. So even in these tight times, we are investing $2.6 million in 6 regional entrepreneurship resource hubs across the state. This statewide system will connect entrepreneurs, innovators, and startups with mentors, with investors, with university support, government and community resources, all to be successful. Just about every growing business in Kentucky, and there are lots of them, are ones that started in Kentucky. The more small businesses we have, the more jobs, the more small businesses that we turn into medium-sized businesses and medium into large, the stronger this Commonwealth grows. There is no more important time to make these types of investments, especially as people have a little extra time right now. What's that great idea? Maybe instead of going back to the job you're at, you're ready to start that next great business. And these RISE, R-I-S-E, office contacts, these areas are going to help us to truly do that. In addition to this new structural announcement, we actually have a couple of big announcements that have been made this week on the economic development side. The first is GE Appliances. I want to congratulate GE Appliances, one of the state's largest private sector employers, on its expansion plans. This company is going to add 260 new jobs. It's going to invest $62 million in upgrades at GE Appliance Park in Louisville. I know we went through many years where we'd wonder if there was going to be a facility here and if we were going to have jobs in the long term. And the future is brighter today, even in the midst of what we're dealing with, than it was 10 years ago. The growth will allow Appliance Park to increase the production of refrigerators, dishwashers, dryers, and washers. GE Appliance Park directly employs 6,000 people in Kentucky's largest city, and we are grateful to see it growing. This all happened in the midst of what we're dealing with. There are some positive signs out there. There's a new one called Faralloy. Faralloy Corporation plans to hire 30 people full-time. It's going to invest $17.5 million in a new steel processing facility in Gallatin County. The company will locate in an existing building on the Nucor Gallatin Mill campus in Ghent, and it's going to make flat-rolled steel coils. It's going to take those from Nucor and then level and cut them to a customer spec. We plan to open this facility this October, openings even at a time when we believe we're going to continue dealing with this virus, and it is a key addition to Kentucky's primary metals industry, which we continue to see growth in. The industry employs nearly 27,000 Kentuckians full-time at 230 facilities. I think it's important as we get together to update the Commonwealth on all types of things that we continue to look at successes that are out there. We continue to let the world know that we are going to carefully continue to reopen for business, and we are looking for those new companies that will help lead us in the next 20 years, especially post-vaccine. That's one bit of good news. Here's another. It's a budget update specifically on the road fund. So the consensus forecasting group, that's a group that comes in, that gives us an estimate, and we've got to adjust our budgets because of it. It's the expert group that is within statute that we have to use, predicted a road fund shortfall of $161.8 million. For the size of the road fund, that is significant and it is severe. But today, we're happy to report the actual shortfall is $100 million less. Folks, that's really good news. We're going to be able to take what's $60 million that's left there, and we've been able to cut it internally by steps we've taken, and CARES Act funding by another $42 million. So what does that mean? First, it means counties. Counties were expecting to lose a very large amount of money because there are shared dollars that work. That number is now much smaller. I think it went from about 37 million down to about 8. That's more money for our county projects. But what else it means is we're going to have more people employed working out there because we have more dollars than expected flowing into our projects. We're going to be able to restart paving projects that have been backlogged where you desperately need it. It's for public safety. And we are going to move forward, we just did here in July, with the first what we call letting, dollars going out to road projects that we've had in 3 months. That is really exciting news. It means you're going to see more construction out there on the roadway, but that's going to keep them safer, and it is going to expand economic opportunity here in the Commonwealth. This is really good news when our budget does $100 million better than a $161 million deficit. We are waiting on the general fund. That's the main part of state government and its funding. I don't want to say I'm optimistic because things are still really rough, but more dollars are coming in than expected, and that suggests this economy is going to rebound faster than we expected, but only if we do some things that we're going to talk about today. Next piece of news is on our unemployment insurance and services that are being provided. The first bit of news is that now, as we sit here today, we have more than tripled our workforce. We went from when this started, about 40 employees up to about 100 state employees. And as of today, we have 220 individuals from our outside contractor, EY, that are actively processing claims. It's taken a little bit of time to get everybody all the tools they need and up to speed, but I believe each EY individual is doing at least 15 calls per day as they're ramping up. You can see how quickly that's going to add up. So as of today, we believe we have about 320 individuals processing claims. This week, Ashland served 1,316 individuals. Owensboro served 886. I'm sorry, that's from before. This week, Hopkinsville has served 1,000 through today, and Somerset 1,000 through today as well. We've also had over 4,600 in-person appointments here in Frankfort. And the news for next week is we are going to be in Covington Monday, Tuesday, Wednesday, in Prestonsburg Tuesday, Wednesday, Thursday. And to continue to have appointments here in Frankfort, you must sign up through this portal. That means nobody has to stand out in the blazing heat that is going on right now. But let me say this. We have 3 times the people making calls to folks. Only about 50% of the time do people pick up. If you've got a claim that is pending, please carry your phone with you and pick up, especially those of you from March. We're trying to call through everybody right now. Have your phone with you. We have more help now than ever before. We want to get you helped, and we want to get caught up by the end of this month. That takes us doing a whole lot more, but we do need you to answer the phone. We believe that things are going to improve and improve dramatically very, very quickly. Another important announcement is we are increasing our CARES Act allotment to our local health departments. Our local health departments are on the front lines fighting COVID and trying to keep everyone in their community healthy. They do everything from educational outreach to contact tracing to even doing pop-up testing sites in their locations, and they've never had as much work as they do right now. So we're announcing today another $36.2 million on top of the first set of dollars that we provided that are going to be flowing to those local health departments. Remember, they're trying to keep us safe. They do have an enforcement role in so much that we do. They are truly the help on the ground in our communities. All right, turning to COVID and the coronavirus. Folks, we are still in a battle, and it is not going away. Despite it being summer, despite everyone wanting to do the things that they used to be able to do, we have a dangerous and deadly virus out there. And we are now seeing a regular increase in cases in Kentucky. We are not yet seeing what we're seeing in other states, and I'm going to walk through all those trends in a minute. But I can say that for the last 5 days, our numbers haven't been bouncing up and down like they used to, between about 120 and 330 or 40. They are now on the high end of that range, if not higher. Today, we are reporting 333 new cases of COVID-19, bringing our total cases to 18,245. We have now had a total number of people tested of 461,756. We currently have 457 people in the hospital for COVID-19. Overall, since it began, 2,747. We currently have 105 people in the ICU. The amount ever there, 1,007. And currently, 4,939 people have recovered. On hospital beds right now, 11,243 of them are occupied, with 7,309 available. Occupancy is about 60%, leaving about 40 out there. We're going to talk about a lot of numbers today that are bad. This is a good number. This means right now we have a significant number of beds for those who get sick. Based on how we're seeing numbers moving and what we see in other states, we may need them. We need this number to remain low. This is one of the really positive signs and one of the reasons that we've been able to do many of the things that we've done. ICU beds currently 1,877 occupied, though most of those are not COVID patients. Available 675. The occupancy is 73.55%. Again, that is a good number with over a quarter of them still available. What we've seen in other states, which we'll show you, is they can get eaten up real quickly if you let your COVID numbers get away from you and they start escalating quickly. Finally, ventilators, only 506 occupied, and whether it's COVID or not, that's a good thing. That means that only 506 people are fighting for their lives on a ventilator. We have 1,448 available, so only about 25.9% are occupied. Those are the good numbers. We're starting to see it everywhere, though. We're starting to see even more positive COVID cases in young children. There's been a daycare in Madison County with 3 confirmed cases among staff. Thank goodness this was before they were opening. We're starting to receive reports of Louisville daycares and others being closed. We don't have names, but due to concerns or people testing positive. We are getting reports in of high school athletic programs having to shut down some of their summer work because of positive tests. We've got to understand that when we have higher numbers, it's hitting all parts of our population. And while a lot of people right now are talking about people in their 20s and 30s, and they should, I mean, age range 0 to 39 is almost 40% of our total cases. 0 to 39, oftentimes you may think you're indestructible, it's not going to hurt you, but 40% of all of our cases are hitting that age group. So we do need better awareness there. That means 60%, a little less, is in the other age group. It means that parents of young children are just as likely to have it, and we shouldn't put all of the blame on an age group that we think should take more responsibility. We all got to take more responsibility to make sure that this doesn't continue to spread. When we look at new cases by county, when you get up to these numbers, it's everywhere. 86 in Jefferson, 42 in Fayette, 15 in Davis, 13 in Warren, another 12 in Bell. And we're going to talk later about the fact that we're going to have a new mandate that's statewide, and some people say, but we only have 4 or 5 cases. Folks from Bell were never saying that, but they will tell you how quickly they went from having just a handful of cases to a significant number, dozens and dozens, just in the last 3 or 4 days. Boone County 11, Madison 9, Caldwell 8, Shelby 8, Hopkins 7, Laurel 7, Hardin 6, Oldham 6, and the rest of it will be online. Here's that state map. And I want people to look at it, and I want you to realize that there is no place that is safer or that we have less COVID-19. That darkest color is in eastern Kentucky, it is in central Kentucky, it is in south central Kentucky, it is in western Kentucky, it is everywhere. And look at how quickly counties can change color. You can look at so many of them that would have been the lightest shade just a week ago that are now in the second darkest shade that are up there. So let's remember, it's everywhere and it can happen fast. Do quickly want to talk about people going on vacations to places like Myrtle Beach, but to all different types of beaches. If you're going to a Florida beach where they're reporting almost 10,000 cases a day, you're likely to bring COVID back, and it will hurt your community. I can tell you we have report after report after report in eastern Kentucky, and in western Kentucky, and in Louisville and Lexington, of 15, 16 people having been infected because someone very recently went to the beach. We just got to be really careful right now. Our actions impact more than just us, and I know getting away is nice, but try to find a place to get away that is safe, that you can relax, but is not a hotspot for COVID-19. Today we're also announcing that we lost 4 additional Kentuckians, bringing our total number of deaths to 612. That's 612 Kentuckians that families miss them. They were taken before their time, and we should grieve with those families. Today it's a 79-year-old man from Edmondson, a 94-year-old man from Knox, a 93-year-old woman from Clark, and a 61-year-old man from Pike County. And I hope we haven't let up on some of the positives that we do. I will tell you that an employee of the Secretary of State's office rings a bell in this rotunda every day at 10 o'clock, every day, because she knows every day there's a family out there that needs us. And I hope you're continuing to light up your home's green to try to show the right type of empathy and compassion for these families. Race and ethnicity, cases non-Hispanic 83.67%, Hispanic 16.33%. On race and cases, 75.71% white, 13.88% black or African American, 3.67% Asian, about 6% multiracial. On deaths, 95.8% non-Hispanic, 4.2% Hispanic. And then on race, 81.39% white, 15.3% Black or African American, 1.39% Asian, and about 2% multiracial. Let's look at long-term care facilities, which we show every time. While we have slowed what we were seeing for a while, we continue to see residents and staff numbers grow. Residents up 41 from yesterday, staff up 18, one additional death of a resident, and one new facility that's had one of these cases. As you know, we are testing everyone in a nursing home. We are doing one of the largest long-term care testing programs in the country. What we're going to be doing here shortly is, once we complete that, switching to a regular testing of staff. Across the country, what we've seen is that most of these facilities where an outbreak occurs, it's a staff member that unknowingly brings it in. And some of these staff members work at 3 or 4 different facilities. So we're going to have a regular monitoring program that's going to try to catch that before it can potentially spread in multiple facilities. Now let's take a quick moment to remember that these aren't just ages and counties of people we lose. They're real individuals that are loved by their families. So today we're going to remember Dana Davis, a frontline healthcare worker at Baptist Hospital in Louisville. She passed away from COVID-19 at just 51 years old. While she was one of our heroic healthcare workers, a review is still being conducted on how she contracted the virus. She was a mother, a grandmother, wife, sister, daughter, and so much more, and she was taken from her family far, far too soon. She enjoyed shopping for antiques, helping others, and most of all, spending time with her grandbabies. She touched so many lives. She had a heart of gold, and she was a hero to all who knew her. Her daughter Brittany asked Kentuckians, please wear your mask, stay home, and social distance for you, your loved ones, and our frontline workers like Dana. All right. Very quickly, we want to give you the locations next week where we will be having testing. Testing is critically important, especially if you are around crowds on the 4th of July weekend. It's now time to get tested. If you are regularly in contact with other people, it's time to get tested. Your kids, if they're playing sports, it's time for them to get tested. Our testing locations next week, and you can sign up right now, are Louisville, Lexington, and Independence in northern Kentucky. Let's make sure that we get folks signed up, that we use every single one of these slots. We're seeing a greater demand for testing. Let's make sure that we take advantage of those resources. All right. So today, we got to talk about where we are and what's happening with this virus in the United States. Let's start with what we're seeing in the United States on that graph. We are seeing an explosion of COVID, where we are seeing record numbers of new cases in this country every day. That after looking at it having balanced out for a little while in May, or maybe into June, almost every day in July is setting a record pace, which means more Americans than ever are contracting the coronavirus. You want to talk about a reason you shouldn't travel right now? Go back. It's because traveling right now means you are on the highest amount of coronavirus in this country that we have ever had since we began for us on March the 6th. This is cause for real concern, and it ought to wake people up in what we're dealing with right now, and that we can't wish it away simply because it's summer or we want to be able to do things that we haven't been able to do. It's not just the United States. We are seeing an explosion in specific states that ought to really concern us. Let's show Arizona. So Arizona is only 1.5 times bigger than Kentucky, 1.5 times bigger. They made some different decisions, but this is what's happened in the last 3 months. On May the 6th, they had 402 cases, pretty close to what we had yesterday. On June 6th, they had 1,119 cases. And on July 6th, they had 3,352. So we have 333 cases today. They're 1.5 times bigger, and they are almost 4,000 plus cases today. That's what happens when this virus gets away from you. When you don't take early action, when you see the numbers going up, this is what happens. And we can't wait until we are getting thousands a day to take certain actions. Let's look at also what's happening, whether it's in Arizona or Texas or others, what we see what happens when we get overwhelmed. Keep going. When we get overwhelmed in our healthcare system. Right? We got states that are running out of ICU beds, states that are running out of hospital beds. We had a doctor, and I don't know if we have the video. Let's play it. Can you imagine being this doctor having to decide between 10 young people and which ones live and which ones die? Because that's happening in certain states.
I got 10 calls, all of whom young people who otherwise would be excellent candidates to be able to put on ECMO. They're so sick that if they don't get put on, they don't get that support, they're probably going to die. I had 3 beds. And just in making that decision, being able to figure out who really is going to benefit, it is a level of decision making that I don't think a lot of us are prepared.
So we got the country where cases are exploding. We have states where cases are growing so fast they're running out of ICU beds and hospital beds, and doctors are trying to decide who gets a ventilator and who doesn't. And we're starting to see an increase, much smaller than these states, but we're starting to see a real increase in Kentucky. So what is one of the things that we have been encouraging people to do that we know can help stop an increase before it continues to escalate? And that's to wear masks. Here's what the scientific community says about wearing masks. As soon as James shows us what the scientific community says about wearing masks. Come on, Kenneth. Now, that's the Retail Federation. We're going to get there. All right. So it's no longer a question. I understand that the CDC and the federal government told us different things, right? But that doesn't get in the way of what the science absolutely shows now. I don't get to go back and rewrite what they told us. All I get to do is make sure I communicate what the science is unquestionable about, is that a mask helps to stop the spread of COVID. It protects other people from getting it from you, and now there are studies showing that it can protect you from getting this virus in the first place. In fact, it's now so accepted that we have 22 different states that have implemented some sort of order mandating face masks. It can decrease the risk of infection. If you wear one, to you, they're saying, by almost 65%. So if you weren't willing to do it for other people before, I hope you're willing to do it for yourself and for your family now. So, number one thing that a mask can do is it can protect the health and the life of yourself and those around you. It can make sure we don't lose more people than we should. It can keep our cases down. But the other thing that it can do is help us to continue to reopen our economy. Don't take my word for it, take Goldman Sachs. Goldman crunched the numbers, and they are saying the difference between people wearing masks and not wearing masks is 5% of our GDP as a country. So if we apply that to Kentucky, the difference in our economy, if Kentuckians routinely wear masks versus if they don't, is $10.4 billion. Everyone that wants our economy to stay open, that wants to see these jobs come back, that wants us to see us not only reopen, but stay open and thrive, ought to be wearing a mask every time they're in public. This is one of the most sophisticated companies in the world, and if you extrapolate what they're saying to us, wearing a mask means $10.4 billion to the Kentucky economy. So today I've signed an executive order that is starting tomorrow at 5 p.m., going to mandate that Kentuckians in public and certain situations must wear a facial covering or mask. What this means is that all customers in retail facilities must wear a mask. In grocery stores, must wear a mask. In most forward-facing businesses, must wear a mask. If you are indoors and you can't get 6 feet from individuals on anything that's not covered, must wear a mask. And outside, if you cannot be 6 feet away from another individual, must wear a mask. Now, it's not just us that thinks that this is the right move. The National Retail Federation and the Kentucky Retail Association specifically asked us to take this action. This is the National Retail Federation that wanted us to open, and they want to stay open. They're now at 50%. They don't want to go back. They've asked every governor to require every individual that's not encumbered by a medical condition to wear masks when shopping in public places. This is to protect the employees, to protect the businesses, and to protect the customers themselves. We are filing this order right now. It's going to be available for the public to see. It's going to start out running 1 month, 30 days. I want to see how well we can do in 30 days. It's going to be enforced by local health departments and others, and it's going to be as simple as if someone won't wear a mask in your place of business, then they cannot be served. It's that simple. When you go into a restaurant or a bar, if you're waiting in line outside, you got to wear a mask, and inside, until you're ready to eat, we're wearing one too. We cannot let where we are, 333 cases, turn into 3,352, and the reason that Kentucky has done so well is we took early, aggressive action. We all bought in, and we did it together. Guess what? We are at that same moment that we were before, but we don't have to shut everything down if we will all follow these instructions and wear a facial covering in these circumstances where it can spread. If we do this, and if we really do it, not just when we think other people are watching, I believe that we can keep restaurants open at 50%. I believe we can keep retail open at 50%. I believe that we can keep the things that we have opened up open. And if we do it, I think we've got a shot at sports that other states are worried about right now. But it's on us. It's on us. It's really going to come down to whether we let personal pride or some belief that we have liberty to spread this thing to others and therefore shouldn't have to wear something like this. It's all going to come down to whether we are willing to do it, whether we truly care about each other and our economy, and whether we're willing to put some personal feelings if we don't like wearing these. And I believe that's maybe 20% of people. If we can put those feelings aside and serve the greater good. And honestly, folks, in the midst of a worldwide health pandemic, wearing a mask makes a lot of sense. And is it too much to ask? I don't think so. So that's it, our future. Our future and what we can do in this state, how our economy rebounds, how safe our people are going to be, the health and the lives of Kentuckians, all depends on our ability to wear one of these. It's no longer voluntary, it's mandatory. And I'm willing to take whatever criticism comes with that. Understand that there are some exceptions. If you have a health condition where you can't do it, kids under 5 certainly don't have to do it. If you are alone in a single room, you don't have to do it. If you're just with your household in your house, you certainly don't have to do it. If you're exercising and 6 feet away from people, you don't have to do it. But if you're going to the grocery store, put one of these on and protect your fellow human being. I'd hope that we wouldn't have to get to a point where we mandated things. I'd hope that we'd all be willing to do the right thing. But I think that the amount of time that we've dealt with this, our anxiety, cabin fever, all of it's added up. But it's time to get serious. It's time to stop our escalation now. It's time to push these numbers back down to a manageable and reasonable plateau. And it's time to make sure that we're bringing in all these jobs we're talking about and stimulating the jobs we have while we are doing it. We've reached out to a number of people about this. We reached out to the Chamber of Commerce, and while they're obviously going to look over the different pieces of it, the business community in Kentucky are supportive. They get it. They get that to continue to open or stay open, that we have to wear these masks. Sometimes we think of Chamber of Commerce and labor on opposite sides. They're not. A lot of our labor leaders, John Stovall being a great one, representing a lot of the bus drivers out there. Remember, we lost a bus driver in Fayette County early on in this. Also supports this additional step to keep members safe. I know we reached out to Mayor Gorton of Lexington, very supportive, seeing what they are seeing there. It is just time to do it. My hope is that we'll do this for 30 days. We'll see cases decrease significantly, and then we can look at whether we need to re-up it or not. But let's not stop doing what it takes to defeat this virus. Did I miss anyone else's quote? Put one more up. Yeah.
It's Coach Cal, and yes, I am ready for basketball. I'm ready to get our students back on campus, but we got to protect each other. We've got to wear our mask. If you go in a building, if you're going to be in social distancing range, inside of 6 feet, have a mask. It protects everybody, but we're hearing now it'll protect you. We in our state have done an unbelievable job. Let's take it up a notch. This is kind of like when I'm coaching, we're winning and I'm being even harder. We are winning. Let's be stronger. Understand, this isn't a statement. The only statement we make when we put a mask on is we care about you. And to be honest, now they're saying you're caring about yourself. Wear that mask, folks. Thanks.
You're going to be seeing other well-known personalities in Kentucky other than Coach Cal giving similar messages. I do want to thank him. He volunteered to do this. And we appreciate his willingness to get out there and to get out there early on it. At this point, we will open it up for questions. We got about 15 minutes. We will also have the documents for the media that are present and everybody at home to where they can look through it themselves. We got a whole bunch of folks because we're in the rotunda and we can spread out a little more here with us, and I wish you could see it. Guess what they're all doing? They are all wearing masks. And we'll go around. We'll start with Michael because he seems ready, and then we'll make it all the way through.
Good to see it. The Retailers Association, their suggestion to do this, was that the tipping point for you, or was it the recent spike in positive cases, or a combination?
The question is what is the impetus or the point where I knew we had to do this? Was it the retailers, the Retail Association, or others? It was really two major things coming together. Number one was seeing a real increase in Kentucky cases, not just a small one week where we went from 120 to 310, and the next week where we went from 140 to 320. It's the last 5-6 days. We are seeing the numbers either in the high 200s and the 300s or even the 400s. We are seeing an escalation of cases in Kentucky, but we're at a point where we can do something about it. It's not 300 one day, 600 the next day, and 900 the next day. We got a chance to do it now. The second piece is watching what happens when people don't act quickly enough across the country. You see that video of somebody trying to decide which of 10 young people gets a ventilator, and I just don't want that to happen here. The retail letter, we'd already made the decision. It was helpful. But, last week I said if we see 4 or 5 days of this, we're going to do it. But putting in a mandatory mask rule, if we were still plateaued, that was going to be something that would be harder for people to accept. But we know we've got to do it with the way things are going. Morgan?
There was a court order by the Scott Circuit Judge basically saying
it was more than that. So folks, Scott County Circuit Judge, I don't think we've ever been in front of, based on a case filed by somebody from that community that's here in state government, ruled today that over 500 businesses in Kentucky don't have to follow any rules whatsoever. And if you look at what those businesses are, They include farmers markets, so I guess farmers market, no crowd control, no hand sanitizer, no nothing. They appear to include distilleries, though I know our distilleries are going to continue to follow the guidelines. I believe I have that commitment. I believe the Pike County Expo Center may be included too. Could you imagine what would happen if they filled that thing up? This is dangerous and devastating, and for a court to say, I guess I just don't believe that the virus exists and you don't have to do anything, no social distancing, nothing else, is absolutely irresponsible. The other thing they tried to do, which you can't do in a restraining order. A restraining order keeps you from doing things, is saying I've got to go through a new process if I'm going to put out an emergency order. It is absolutely wrong under the law. We're sending it up to the Court of Appeals. We're going to get this to the Supreme Court. But folks, there are constitutional officers in this building that are pushing it. They want you to go to a farmer's market where there are no restrictions, meaning you're going to get the virus. This shouldn't be political, and it all seems to be. There's the AG in Kentucky is the only AG in the country suing their governor over these restrictions. We got to move past it. I'm going to continue to do what it takes. He put in that order today. We're doing the mask mandate today. We'll beat him in court, and just because the circuit judge there, I guess, thinks he's an epidemiologist and we don't need any types of restrictions, I know that's not the case. Lawrence. This is a little stronger than intended to be.
One exception you said was people with health conditions. Do you have to prove that they have a health condition or something like that?
If you have a health condition like significant asthma or others that prevent you from wearing a mask, don't wear it. And if enforcement is there and is asking you, just tell them about it. Listen, everybody wants people to do this. They want them to come on voluntarily. It's not going to work unless people are willing to do it. There's not enough people out there to enforce everywhere. And so if you have a health condition and somebody asks why you're not wearing a mask, just politely talk to them about it. Now, if you have a health condition which means you can't wear a mask, boy, you need everybody else wearing a mask, don't you? Because that means you're more susceptible to the virus, most likely, because of lung conditions that are there. And so my hope is that anybody who can't do it is pushing as many people around them to do it as possible. Daniel. The consequences of not wearing a mask are going to be in the order. Certainly for individuals, it's going to start with a warning. Ultimately, we believe that if there is chronic refusal, it could lead to a fine. For businesses that aren't trying to enforce it, there are those that try that might not be able to get there. There's going to be significant consequences. I will tell you that I know individuals that went to a restaurant in Western Kentucky just this weekend, maybe 3 days ago, and none of the employees were wearing masks. That would result in the shutdown of the restaurant. Is it Tyler?
Yes. Other states have also followed by closing down bars. Is that a move you think that you might make next?
So the question is, other states have also moved to close down bars. Now those states are seeing a more significant rise. I'm actually having a discussion tomorrow with a number of bar owners about what other steps that we could take that could prevent the types of congregation that we are seeing inside of bars. Now, this mask rule will go a long way within bars, because what we are seeing is we're seeing packed lines to get in. Now, you got to be wearing a mask, standing in line even outside. Now, when you are in a bar, you got to be wearing one until you're having the drink. If you're just hanging out with folks waiting for it, you got to have that mask on. And we're going to look at some other things. It may make it look more like a restaurant where you primarily serve drinks, but I want to give them the opportunity to be able to stay open if they're willing to follow the things they need to. Is it Michael? Yeah.
What's kind of the projected number that you guys are looking at, whether you re-up the executive order or if you let it expire?
That's a great question. The question is, what number are we going to be looking for on, and it'll be more than just cases. It'll be cases, the positivity rate, the number of hospital beds that are available, the number of ICU beds that are available. We'll be looking at all of those and where we are trending. I believe that if we all embrace this, we could eventually even see a decline. Tom?
There's going to be attorney general lawsuits. We have one that, two, I guess, church-related ones that are floating around in the Sixth Circuit at this point. What's your take on where that stands and how it's going forward?
The question is on some lawsuits related to churches that are floating around the appellate courts. The Supreme Court's already ruled on this. It was in California that a governor has the authority. It actually disagreed with the previous Sixth Circuit case about one of my orders. This thing is settled. Now, the fact that the district judge didn't believe that it was settled won't stop either, we hope, the appellate court or the Supreme Court. I mean, when the Supreme Court is very clear in saying that you can do this, our hope would be that it'd be done and we wouldn't see any other lawsuits. That's supposed to be kind of the final place. I want to give an opportunity for Dr. Stack to come up to talk about masks. I forgot that, how critical they are, and then we will do one more round of questions.
Thank you, Governor. I work for a good guy. I would have graciously not had a problem if I didn't have to talk, but I'm grateful for the opportunity because this is important. So I had two things I was going to add that he didn't mention, or that I didn't plan to mention. I didn't expect him to show an emergency physician video, and I want to remind folks, I'm a public health commissioner now, but I've been an emergency physician for 20 years. And so I've been close to death, and I know what it's like to tell a loved one that they've lost their family member or the difficulty that represents. I'll tell you, my colleagues in New York and the colleagues in these other parts of the states, this is horrifically traumatic. You have people who devote their whole lives to helping you at the worst day of your life when you show up in an emergency department, and these folks are going to be in there now, sometimes probably still without the right protective equipment because the country still hasn't increased the capacity for producing protective equipment enough. And they're going to show up in there and they're going to have to tell family members they can't do what they know how to do because they don't have the space, they don't have the tools. So folks, please, you've seen all these images of them showing signs. We're here for you, you stay home for us. They mean that for you to stay home for you too. So please, listen to what we're telling you because don't put them in that spot of having to tell folks all over the country that they can't help you because there's not enough space at the end. Second thing, Secretary Friedlander and I signed today an order to add to our efforts to try to make it easier for people to get tests. So this order says that within the Commonwealth of Kentucky, a clinician's order is not required to get a diagnostic test for COVID-19, specifically a molecular diagnostic test. So this is the PCR test where they test your nose. Second, an order is not required for insurance companies to cover it. And third, that it doesn't represent a doctor-patient visit for you to get that test. Now, I'll be very brief now because this is the question phase. Folks, wear a mask. It's not a drill. This is the biggest public health, or at least the biggest infectious public health threat that our species has faced in over a century. I don't have any graphs today. If you want to watch a video, I just posted a new 6-minute one on our KY COVID-19 website that goes over our journey. Kentucky crushed the curve. They crushed the curve here in Kentucky because the governor took quick and decisive action. He surrounded himself with good advisors and he makes good use of them, and because you listened to the things he asked you to do. You stayed healthy at home in March and April, and because you stayed healthy at home, for the first time in a long time, Kentucky's not at the bottom of the pack for public health, we're at the top. We have one of the best epidemic curves in the nation. People have made hard sacrifices. There's economic sacrifice. There's sacrifice at your businesses. There's sacrifice for your social lives and your school and your sports and all sorts of other things. If you don't keep up the simple things now we're asking of you, to wear a mask and socially distance and a handful of other things, it'll all be undone. And the fact that our curve is now increasing shows that what's happened in New York early and now what's happening around the Sun Belt in the West is going to happen here. And Governor, my last thing, I'm sorry to ask your indulgence. I know folks are listening. I know for a lot of reasons. I get letters from some of you. I get little tokens. This is from Ray in Louisville. Ray apparently noticed that I walked up at one of these briefings and noticed that I was near the end of my notebook. And his note was really simple. He said, I noticed you'd reached the end of your notebook, so I'm passing on one I had not started. It's just a simple act of kindness. The man sent me a leather-bound notebook so I could keep writing my notes and come up here and talk to you. All we're asking you to do is a simple act of kindness. Wear a mask, do it for yourself, do it for the people you love, and do it for the vulnerable people around you who can't protect themselves otherwise. Wear the mask. It's It's not a lot to ask, but boy, is it a big impact. And if you need any evidence, you just got to see what's happening in the South and around the western part of the country. It is a horror to unfold. Don't put those ER docs and nurses and all the others in that position of telling you they can't help you because there's no room in the end. Thank you.
All right, I had a couple questions that were submitted. One from Karen Czar. What is my response to daycares that have chosen to go back to full capacity? Because that's a order from a judge in northern Kentucky, again, elected by a few thousand people as opposed to statewide, where daycares, I think he allowed the daycare that was involved to give the number of how many kids should be able to be in one group. I think it's 28. That is not safe. Folks, don't send your kids to a daycare where they put 28 kids together at a time where you see what's happening in Arizona, Texas, Florida, and our numbers are going up. It is not safe. It is dangerous. It could be devastating to a family. And while young people might not die from this virus, it can be incredibly painful, harm them, and they can bring it home to grandparents. I would not send my kids to a daycare that's not abiding by the regulations we put out, because I trust Dr. Stack more than Judge What's-His-Name in whichever circuit that he is in. Oh, we missed him. I guess he's going for the five. Lawrence. So we put up our priorities. I meant to start all of it here. I've got 3 priorities in all of this. Number 1, the health and safety of our people. Number 2, restarting our economy and keeping it open. And number 3, opening schools. If we can do what we're talking about today, and we could truly get everybody wearing a mask when they're in public, we'll be able to reopen schools. You know what? If parents wear a mask in public, their kids are going to wear a mask in school. If we want to be healthy and to save lives, if we want a healthy economy, and if we want schools to be reopened, this is it. And we're starting this early enough to where I think we have a real shot. And, you know, those that are out there that are nervous, and they should be, wait until they see everybody wearing masks, following the rules, and doing what it takes. If we can't get people across Kentucky wearing masks, the opening of schools is going to be certainly at risk. Well, if people do what they want to do and they don't follow the restrictions, we will see more people get the virus. We will see more people die. We will have to roll back parts of our reopening, reduce capacity at different businesses. We probably will have problems opening schools. If people don't follow the rules and the regulations, that's what we'll face. This is on us. This is truly on us. Everybody's actions have consequences. If you're not willing to wear a mask, social distance, practice good hygiene, and follow the rules, then we're not going to get to do so many things that we can do right now. This is our moment to prove that we can beat this virus again. So we were way up in the score, and guess what? It caught back up. We can either quit, walk off, and lose, or we can get back to doing the hard work and hustle that it takes to win the game.
So I know health departments are going to be enforcing this, but a lot of implementation is going to fall on businesses still. Do you have any
That's right.
recommendations for these businesses? Large ones might have a hard time monitoring all the customers inside. Many have expressed issues with customers who refuse, things like that.
So the question is advice to businesses. First, as we saw today, the National Retail Federation wants this. And it makes it simpler when it's just a requirement. You want to go into a retail place, you want to go in to a grocery store, wear a mask. No ifs, ands, or buts. If you don't have a medical condition, you got to wear a mask. Otherwise, you don't get to check out, right? And if anybody's yelling at a cashier or somebody else working there, I hope they just walk away. Person's not allowed to walk out with the stuff. This is just, we have a no shoes, no shirt, and no service. You know what? We're in the middle of a worldwide pandemic. It's now no mask, no service. And when things were under control, sure, there was risk at those grocery store workers, but especially with things moving out of control and us wanting to stop it right now, this is the chance. But I believe if we're clear and we don't have a lot of exceptions, then people absolutely know the expectation. It gives us our very best chance of getting it done. Last one. Oh, no, you get the last one. Yeah.
As far as people who say, well, we're not Arizona, we're not Florida, we're not Texas, what do you have to say to those folks?
The question is to folks that say, we're not Arizona, we're not Florida, we're not Texas. They weren't at one point either. Can you put Arizona back up? So yesterday, we were 400 and something cases. 2 months ago, so was Arizona. And Arizona went from 500 cases to 1,000 almost overnight. It happens that quickly. All of these states thought they had everything under control. Many states around us at one point started showing lower numbers and said, hey, see what we're doing? And guess what? Those numbers are dramatically increasing. Yes, we are not Texas and Arizona or Florida because we're going to act faster. This is going to be a clear mandate, and our people are going to come together knowing what's expected of us, knowing what's on the line, knowing $10 billion is at stake along with the health of our people, and we're going to get it done. Last one. The question is, should restaurants bar people from coming in if they refuse to wear masks? Yes. Wear a mask, sit down, obviously take it off before you eat, but this is the way that we got to do this. A decision not to wear a mask, you can think that there's some liberty component, but any of that ends when you put the health and safety of someone else at risk. You're not allowed to run into a movie theater, yell fire, and then claim it's your freedom of speech. You know, when your, I missed you. When your claims of your rights then put other people in harm's way, that's when the law says that they end and other people's rights begin. Sorry about that. This is really the last question. I'm not responding to Daniel Cameron's response to what I say up here. Listen, the other day, that constitutional officer filed a paper to try to nullify every executive order that we have made to date. Folks at home, could you imagine with Texas and Florida going where they are, if I didn't have the authority whatsoever to put in any restrictions to stop this from spreading? What do you think would happen? You know what? A judge that does a statewide injunction acts irresponsibly. They're elected just like I am. You know, they criticize me in their briefs. They can handle a little themselves as well. This isn't an attack on any individual, but once you say that 500 businesses don't have to have any restrictions at all, no social distancing, no hand sanitizer, they don't even have to clean, then you put people at risk. I'm beyond the politics. I'm not going to go back and forth with any of them. I'm just going to do the right thing. They've got the choice to do the right thing. If they don't, that's okay. I'm going to do it for them. Thank you all very much.